Today we are going to discuss about cor pulmonale. Cor pulmonale is one of the cardiac complications. This may occur mostly due to two conditions, cardiac as well as pulmonary disease. Next we can see what do you mean by cor pulmonale. It's a right side heart disease caused by abnormalities of the lung parenchyma, airways, thorax, pulmonary circulation or respiratory control mechanism, or else due to enlargement of the right ventricles. And there are two major types, acute and chronic. Enlargement of the right side of the heart is due to high blood pressure in the pulmonary blood vessels, usually caused by chronic lung disease. The types of cor pulmonale are acute cor pulmonale and chronic cor pulmonale. Acute cor pulmonale means is the right side heart failure mainly due to overload that happens due to massive pulmonary embolism. Chronic cor pulmonale is characterized by hypertrophy and dilatation of the right ventricle secondary to pulmonary hypertension caused due to disease of the pulmonary parenchyma or pulmonary vascular system. The etiology of cor pulmonale are, first we can see etiology may be due to lung and airways. So under lung and airways, the most important causes are COPD, that is chronic obstructive pulmonary disease, asthma, bronchiectasis, pulmonary tuberculosis, cystic fibrosis, interstitial lung disease, obstructive sleep apnea, pneumoconiosis. Second etiology is due to vascular occlusion, maybe due to multiple emboli, that is pulmonary embolism, caused due to pulmonary embolism, filariasis, sickle cell, polycythemia vera, or pulmonary hypertension. Next etiology is the causes mostly that happen in the thoracic cage, maybe due to kyphosis, scoliosis, thoracoplasty, or pleural fibrosis. Next is NM disease, neuromuscular disease, that happen due to respiratory muscle weakness, maybe due to poliomyelitis, myasthenia gravis, or muscular dystrophy. The next etiology is related to abnormal respiratory control. So the causes related to abnormal respiratory control are idiopathic hyperventilation syndrome, obesity, hyperventilation syndrome, and cerebrovascular disease. Next we can see the pathophysiology of cor pulmonale. So the above said causes may leads to alveolar hypoxia. Hypoxia may happen within the alveoli that leads to hypoxic pulmonary vasoconstriction. This vasoconstriction may be happen due to acidemia as well as hypoxemia. Hypoxemia means decreased oxygen in the blood. Then due to hypoxic pulmonary vasoconstriction, increased pulmonary vascular resistance may occur and that causes pulmonary hypertension. This pulmonary hypertension causes increased right ventricular afterload that causes right ventricular hypertrophy and right ventricular failure. So next we can see the clinical features or clinical manifestations of cor pulmonale. Dyspnea, it's difficulty in breathing may happen. Chronic productive cough occurs. Wheezing, while we are auscultating, we can able to hear the abnormal wheezing sounds. Retrosternal or substernal pain due to right ventricular ischemia. Fatigue, fainting spells with activity. That means while during activity the person may used to develop fainting. If chronic congestive heart failure, in case of chronic congestive heart failure, the person may used to develop edema and neck vein distension, that is jugular venous distension. Then enlarged palpable liver, ascites, and pleural effusion may be occur due to this cor pulmonale. Next we can see the laboratory findings. Abnormal heart sounds, we can able to, on auscultation we can able to hear abnormal heart sounds. Right ventricular hypertrophy is characterized by left parasternal or subxiphoid heave. Then hepatojugular reflex and pulsatile liver are signs of right ventricular failure. Then we can able to hear hyperresonance of the lungs, maybe one of the sign of underlying causes of COPD. Edema also present. If we are doing ABG analysis, we can able to see hypoxemia, hypercapnia, respiratory acidosis. While doing CBC, complete blood count test, we can able to identify hematocrit for polycythemia conditions. While doing X-ray, prominent pulmonary hilum can be identified and due to the presence of hyposcoliosis or hyperinflated lungs. EKG, in EKG we can able to identify pulmonary pattern, increase in P wave amplitude in leads 2, 3 and AVF, right ventricular hypertrophy. If you are doing cardiac catheterization, we can able to measure the pulmonary pressures. Then next is the echocardiography is the another diagnostic measure which helps to identify right ventricular hypertrophy and pulmonary hypertension. So VQ lung scanning, ventilation perfusion scanning or pulmonary angiography, CT scanning. This can be done to diagnose pulmonary thromboembolism. Then we can see the treatment of the cor pulmonale. First major aim is to treat the underlying disease. Steroids, infection control, theophylline can be administered. Continuous oxygen needs to be administered, which should be less than 2 to 3 liter per minute. Bronchodilators, example, theophylline can be administered. Diuretics, low sodium diet is prescribed. Digoxin for congestive heart failure. Anticoagulants, example, warfarin. Then need to treat the pulmonary hypertensions also with the help of vasodilators, calcium channel blockers. Then next we can see the surgical management. The common surgical management we used to involve is phlebotomy in case of severe polycythemia. Then lung transplantation is the another surgical management. So today we have discussed about cor pulmonale, which is one of the most important cardiac complications. It is otherwise called as right side heart failure. There are major two types, acute as well as chronic, and we have discussed all about the pathophysiology, clinical manifestations, etiology, as well as the treatment measures. So hope you understood this class. Thank you.